Welcome to the South Asian Health Show. I'm your host, Rena Gill. Super excited to bring this episode to you today. Our special guest is Dr. Romie Dhaliwal. She's Doctor of Optometry, and we're going to talk about eye health in general and specifically in the South Asian community as well, and if there's any particular issues that the community might be predisposed to. So, Dr. Romie Dhaliwal, how are you today?
I'm so good. How are you doing?
I'm awesome. So happy to finally have you on. I know we've tried to coordinate a few times, but busy women. We're busy women over here, right?
I feel like I've known you though, because like Instagram, right? So
I know. And isn't that cool? The cool thing about social media, and it's like people even though you haven't met them in person, and you kind of see what they're doing day to day. And I see that you're always very active on social media as well. And that's just kind of like the way it is.
Yeah.
These days, right? The way of the future.
For sure.
So I'm so curious to know, let's start off by finding out about your background. What inspired you to get into optometry?
So, wow, I haven't had anyone ask me that question in so long because I've been in practice for almost 12 years. But I found a grade 6 project about the eyes. So I knew that I didn't know it went back that far, but I was always interested. Something was unique about the eye to me. And when I was in high school, my physics teacher was like, hey, there's another East Indian girl that, graduated from the same high school as you, went to the same I was going to University of Winnipeg. And she's like, oh, and she's also graduated from University of Winnipeg. And she's an optometrist now. You should go shadow her. She's my optometrist. So that's how I got set up. And I ended up shadowing her in grade 11, I want to say. And I'd go in and with my clipboard and just watch her, and really got very interested in the field of optometry from there. And then she was like my mentor and wrote all my references for optometry school. And when I graduated, she hired me. So I was working with her, under her, for almost 11 years. Until recently I left, which was a really
Girl,
big
you
step.
took it way back. You took it to grade 6.
Yeah.
What you wanted to do in grade 6. That's absolutely amazing. I mean, people are still like in their 20s and 30s trying to figure it out, and that's okay.
I know. I was cleaning my room. I've been in the same house since I was like 2 years old, and I was like, okay, time to like empty. My husband is very he's like, you're such a hoarder, but I have a lot of stuff from elementary school. And I was like,
we all are. We all are. Is it a woman thing?
It might be, right? I don't know. So yeah, I found the project and I was like, what? Like cataracts? Did I even know how to say any of this stuff? And yeah, I had all the clippings and everything. And I was like, oh, I didn't even know it went back that far. And I was like, Mom, I liked eyes from the beginning. She's like, yeah, you always chase cats and you loved their eyes and light eyes. You always commented on that. So yeah, there was a connection there.
That's awesome. No, I love that story. I love that connection too. And the fact that you remember, that's amazing. You still have that project?
I do, unless my husband tossed it out, but yeah.
No, I hope you still have it.
I know. Yeah. It's in the nursery, which was my room before. Now it's the nursery, but I don't know if he tossed it out.
I was just going to say you can hang it up in your new place.
Yeah.
Because you're right now in a transition phase and you're starting your own journey, opening your own business. So why don't you tell us about that?
Yeah, I never thought this was going to happen. I thought I would just partner in where I was because it was so comfortable. And, things change. And I felt that I needed to do more. Like it was just too comfortable. And when you get too comfortable, I feel like that's kind of dangerous because you just lose some ambition. It was just like, go to my job, come home, never really had an interest in a specialty with optometry. And recently I've been really interested in myopia control with kids, trying to control their eyes from getting worse. And there's stuff out there now that can help. And dry eye is such a big thing after COVID, especially younger people. And I just noticed I'm I can't do anything here. I need to go and explore something for myself. And so, yeah, that's what I decided to do. I left my job of almost 11 years. And right now I'm in this transition phase where I'm just helping a colleague out with a mat leave. And then I want to transition into starting my own practice, which will hopefully happen next year by spring, crossing my fingers. And yeah, I want to specialize in dry eye. And so that's what the goal is.
We're crossing our fingers as well, Romie, because we are going to be launching the South Asian Health Magazine Winnipeg edition. You are going to be our feature cover story. So we are highly anticipating you're opening your business. We're going to be right there with you promoting your brands. And up until then, as I mentioned, we're going to have you regularly on our show. We're going to talk about different issues when it comes to eyes.
Yeah.
I myself deal with a lot of allergies. I want to say seasonal, mainly spring, summer, but girl, it feels like all year round.
I know,
I
so
have
bad.
issues, but when it comes to the eyes, like the first thing you would say as a doctor, you would say, well, Rena, you're wearing a lot of eye makeup. So maybe that's why, right? But to tell you quite frankly, on a day-to-day basis, I don't wear makeup.
Oh.
But my eyes are very, very sensitive. It's been like this for ages. And so I wonder if it has anything to do with food that I eat. So that's a whole other conversation when it comes to allergies, but like what the triggers are. But when it comes to the South Asian community specifically, are there common health issues that you see pertaining to the eyes?
Yeah, I mean, I feel like diabetes is huge in our community and it's not recognized, right? Where if I ask a patient, what are your health conditions? They often have not highlighted in their case history that they have diabetes. It's almost like it's a secret. It's like, oh, I have a little bit of sugar. And I'm like, a little bit of sugar. Are you on a medication? And they'll say, oh yeah, metformin. Well, you're diabetic. And so I feel like it's kind of under the table, but I see so much of it in the eye, just with the diets we have, right? A lot of sweets. So I feel like diabetes is a major one. Cataracts is often a huge one as well. And in younger men, I've noticed. I'm in the prairie, so it snows here, it's flat. And so we get a lot of UV exposure in the winter. So a lot of the, taxi drivers, truck drivers, a lot of the drivers are from our community. And so they don't wear sunglasses. And I feel like that's a huge thing in our community, is that wearing sunglasses is like, oh no, like I don't need sunglasses. It's like, they think it's like, oh, I don't want to look too fashionable with wearing my sunglasses. It's a weird thing. I don't know what it is.
Really? I didn't know that. That's very interesting.
Oh, men, they're like, oh no, people will be like, oh, I'm wearing sunglasses. I don't want to be wearing my sunglasses. Or if they're driving a taxi, they'll be like, oh, I can't see my screen or whatever. And so I find that they get cataracts sooner, like 40s and 50s, where it's usually like later 60s, 70s, or 80s even.
You did an article in the magazine about UV radiation.
Yeah, I did, because I find that like kids, it's not common to see kids with sunglasses, right? Just in general. So it's kind of emphasizing, hey, there's no age. You should be wearing sunglasses at any age. Start young, get used to them. So yeah, diabetes, cataracts, and I find that dry eye is huge in our community as well. Any auntie, uncle, like any patient that I see, they're like, oh yeah, I splashed cold water in my eyes. And I'm like, no, don't do that. Like, oh
my God. Do you know how many family members have told me to do that?
And in Punjabi, in Punjabi, it's like thande pani de chitte. And I'm like, no, please don't do that. You want to use warm, warm. Don't use cold water on your eyes. So yeah, I feel like the glands get plugged up even more. So yeah, these are main things that I've noticed. I'm surprised more kids don't come up with clogged glands, just because, like wearing the eyeliner under their eyes, right? Like low, for example, that's been an issue. But yeah, I think these issues have been pretty big.
So I'll quickly tell you about a personal health issue that I've been dealing with for quite some time. And some of our viewers have heard me talk about this before, but ever since I was younger, I've been dealing with migraines. And it is hereditary. Unfortunately, both my parents, have migraines. And then I'm much better now than I was when I was younger. When I was younger, I used to get them nonstop. And I guess over the years, I developed a sensitivity to light.
Yeah.
So there is an ongoing joke amongst my family and friends that I'm a vampire. I like to sit in the dark. And as you can tell right now, it is dark. I have the lighting obviously for the podcast, but obviously then what happens is my eyes are not used to the light. So I tend to blink a lot then. So, but I still need the lighting. So it's okay. It's temporary. But for the most part, when I used to work in the corporate world, in my office, I used to have dim lit lighting, and everyone used to be like, why, what's with the romantic setting? You're at work. I'm like, no. Don't take it the wrong way. It's pretty much that it's just my eyes are so sensitive. So you mentioned about sunglasses. I'm very good with wearing sunglasses when I'm out and about, but that's partially because of the light sensitivity. But I don't know what to do indoors, because majority of the time, and it's funny because if people come over, they're like, really, you're trying to save on your electricity? I'm like, no, oh my God, it's that bad, that dark.
So that's interesting. I find that, do you feel like you have dry eyes?
So this is something that I've been hearing from you in some of your social media posts. And so I never heard much about it before. And I don't know, maybe I do. What are some of the symptoms of dry eye aside from
so
is it itchy? And
it's more watery. Like, so the first thing patients will say is, oh, how can my eyes be dry if they're always watering? It's like, well,
100%. I was just going to ask you that.
Right? It's kind of contradictory. Yeah, I know. It's just, there's layers to the tear film. So if you're missing that oil in the front and the tears have nothing to stick to, they're falling on your face and they're not doing what they're meant to do, which is lubricate the eye, right? So your brain's continuously producing more tears because your eyes are feeling dry, but there's a missing component there, and the sticky layer is not there to help. So so watery eyes, burning eyes, red eyes, all of these are signs that your eyes could be dry. Or if it's super mild, you might not even have those symptoms, but you have light sensitivity. So your tears aren't helping protect you from that light, right? So it could be off of any screens. You can get screen protectors that kind of help with that blue light, right? If it's too bright, just dim the light down on your phone, the blue light, the night shift mode. But what you're doing, like by decreasing the light, I mean, that's a good step.
Oh yeah, I'm quite content being a vampire. This is my life. That's what I'm used to. It's all good. So when it comes to, like, we're talking about like how some of the Punjabi auntie and uncle, like they have this like whole like, oh, do this, do that, that'll help you, these home remedies. Are there any like actual home remedies in general that day to day that we can do just to kind of take care of our eye health until we come to see a professional like yourself?
For sure. Starts with your nightly routine, like flossing your teeth. I tell patients, like, clean out those eyeballs, like, there's lid wipes, there's lots of products on the market to clean out your eyes. Water doesn't do justice, right? So I mean, for women it's makeup, but we touch so many things throughout the day, and we touch our eyes and we just splash water on our face and then we're off to bed. So but cleaning the eyelid margins is very important. Like I said, no cold water, always use warmer temperature on your eyes. Steam is so lovely for your eyes, like those glands pop open, right? You want to get the all the oils out, not plugged up in there with cold. Sleeping masks are great overnight because some people don't realize that they sleep with their eyes open and their eyes dry out. In the morning they feel like it's like gritty in their eyes. So
that sounds creepy.
Right. Actually, there's something called floppy eyelid syndrome. So like if you're sleeping, your eyelid rubs against your pillow and it flips up. And so no one would know, right? So these kinds of things, like, you don't think about, but just like a mask will help kind of press down those eyelids and keep everything out.
How do you steam your eyes? Open?
Just like, no, like I have one from Amazon, but it's like that plug-in, right? The really cute, pink one. Yeah.
Women, this is what we do, right? Beauty regimen.
So it's just funny. Nice, just over the face, just steam. And that steam is so helpful for your eyes.
So eyes closed.
Yes, eyes closed. The oil in there gets all melted, and then if you give it just like a gentle massage on the top and the bottom, all that oil comes out of there. And so you find that, it got blurry. And sometimes you might notice that after the shower, right? And then you're like rubbing and it's like, oh, my eyes are blurry. Well, that's the oil that should be on the surface of your eye evenly throughout the day. It's coming out all at once because it's plugged up in there. And that's how you get styes. So if you want to prevent styes and all that stuff, that's a good home remedy to do.
And you also mentioned lid wipes.
Yeah.
So is that something in particular you can buy?
Yeah, just
Okay.
over the counter. Yeah, and at your optometrist office, they have like, there's so many brands out there, but yeah, like you don't, back in the day they used to say baby shampoo. It was even written in our textbooks, but yeah, like use baby shampoo on your eyelid margin because it's like, it's sensitive for babies, but it's now shown that it actually strips layers off of your tear film and your eyes get drier. So it's good for like treatment of like, say you have like a pink eye or something and it's like a natural, antibacterial, but there's so many better like lid wipes out there, like with tea tree oil, which is shown to be really helpful for dry eyes.
So we just did a really cool episode on vitamins and supplements.
Ooh.
I'm not sure if it's going to come out before your episode comes out, but I thought that it would be cool to find out what are some vitamins in the market that are good for eye health.
Yeah, that's a good question. So like people that have like family history of things like macular degeneration, they can start taking vitamins early. And it's called, like, for example, there's Vitalix for healthy eyes. And that's for people that have like a very strong family history of stuff like that. But for general, like, health and, if you just want to take vitamins, but like getting vitamins from food, I would highly recommend first, like green veggies, like all the rainbows, like you need all the colors. Before it was like green, 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 but that's not true. Like you want to eat all the colors in moderation, like, and then green veggies have lutein. And so lutein's a great one to take as a vitamin if you can't get it in your green, like, spinach, kale, broccoli, and all that fun stuff. But yeah, like vitamin A, B12, omega-3, these are all anti-inflammatory. So once again, going back to dry eye, if you take these vitamins, that'll help with your eyes. And like turmeric is actually a great anti-inflammatory, and we know that as in our community, turmeric is in everything. I wouldn't drink a turmeric latte, but I would put it in my food.
I know that doesn't sound very appealing to me either, but
Ugh.
I am one of those people. I do take turmeric pills because when I'm traveling for business, I'm not eating roti sabji on the road. So we pop the turmeric pills on a regular basis. That's what we do.
Yeah.
I just realized that it's back to school season. And now that kids are going back to school, it just dawned on me because I do have some kids in the family who are already wearing glasses.
Right.
Are you seeing a phenomenon like younger kids having eye issues?
Yeah. Oh gosh. I see so many kids. Like my last practice, it was 90% kids, and it's all I saw. And it's getting really bad because it's all screen time, right? Like it's impossible. Like, we recommend 2 hours for like, I can't remember the age brackets now, but it's like 2 hours is like usually like, okay, max out. That's under 15. Don't go on the screen for more than that. But it's impossible because schools have screen time. Chromebooks are being used in school all the time. You're maxing out on that screen time at school. And then the one that by the time you get home, right? It's kind of, so I feel like we're using our eyes too much up close. That's what it is. We need to take more breaks. We're always harping on the every 20 minutes, take a 20-second break and look 20 feet away. I don't know if you've heard of that. 20-20-20.
Yeah, I've heard it here and there.
Yeah. It's a popular one. It's like, take a break, just look in the distance, go for a bike ride, like, that kind of thing. So yeah, I do notice kids are wearing glasses more and more. That's why they had to come up with something to kind of stop and control it and prevent it from getting worse, because like, where they're predicting like 58% of the world by 2050 is going to be nearsighted. Right now we're at 28% or something like that. So that's scary. These numbers are scary.
I don't have any kids, so I'm not one to judge on anyone's parenting skills over here. I'm just going to put that disclaimer out. But a lot of parents, and I understand parents are stressed. They've got a lot on their plate. So what tends to happen is they need to keep their kids busy. They tell them, hey, take the iPad, and for hours and hours and hours, the kids will just be sitting there like this with their iPads. And that's obviously affecting their eyes.
Yes. I mean, I have a 2-year-old and I was going to be one of those parents, like no screen time at all. Like, impossible. Like you can't do that. You need a break. But we encourage this distance, right? TV, like the further away it is, the better. iPad is the next one in line, but arm's distance, prop it on something. And then the last is like the phone, which is like the worst because it's close. So that distance is important. The breaks are important. With a toddler, their attention span is like what, 2 minutes? So they're like playing around and they just like to have the noise in the background. They look up at the TV and then they're back to doing something else, right? So it's better than them staring up close for so long at some devices. But yeah, no, that's a common one. And biggest thing nowadays is, yeah, like our community is very like, oh no, glasses. It's like diagnosing your child with cancer. Like that's how they treat it. And then right away it's like punishment. And we shouldn't look at it like that, because it could just be genetics, right? There's so many reasons why one needs glasses.
I have actually a quick story to tell you before we wrap up.
When
I was about 14 years old, so my eyes they're not bad.
Yeah.
I do wear contact lenses for vision when I'm driving, or when I'm like out and about, but on a day-to-day basis, I don't wear anything. I have glasses if I need to use them, but my eyes are pretty good overall. But when I was younger, I don't know, like maybe because, my mom wears glasses. I don't know. The doctor was like, you should get them, I guess, mainly for school purposes, because I did have to kind of sit at the front of the class, which I didn't want to do, but like for vision purposes. And so I had glasses. And then around the same time, I went to the orthodontist, and the orthodontist was like, oh, so it's time to get braces.
Oh, no, double whammy. You're like, no.
Like, your teeth are not so bad, but later on, it's better to get it now, be proactive. I was like, oh my God, glasses and braces at the same time? No. I was like, we need to spread them out. It's not happening. You cannot, that's like full on. And you know what? I love all the nerds out there. Nerds we love too. It's all good. We're not discriminating, but we know glasses and braces
together is just what a combination, right? Exactly, right? No.
so I did braces. Glasses on a down low, whatever, absolutely, have to do it. But I refused to wear them at the same time on a regular basis. I was like,
fair enough, right? Yeah.
So I just feel that, it is what it is. I think a lot of times maybe people are hesitant to wear glasses for whatever reason. Some people just don't think glasses suit them.
Right.
And
there's contacts. Yeah.
But then maybe contact lenses are not comfortable. So I find that there are some people out there who just won't use anything, but they're not realizing that they're putting extra strain on their eyes, which is in fact making their eyes worse.
Yeah. And like you said, now that I'm thinking back, I'm like, I didn't address, maybe you have astigmatism. That's why you're so sensitive to light. So I'm really interested in knowing what your prescription is. But yeah, there's a middle number there called the cylinder number. And if you have a number like there, that could mean that, you have astigmatism. And if you're not corrected for it, lights are just so bright in your eyes.
Mine is a minus 2.5.
Okay, so you're nearsighted. Yeah. And then anything else in there?
No? Not that I know of. I have to check.
Yeah, okay. Yeah, we'll investigate after. Yeah.
I'm really come to Manitoba and see you there, Dr. Dhaliwal. Get my eyes checked.
Yeah, come visit.
This is awesome. You're always sharing such wonderful tips on social media. I love the fact that you're super active. So if our viewers want to follow you on social media, what's the best way they can do that?
So my Instagram is pretty simple. It's Dr. Romie Dhaliwal. And they can follow me. My page is open. And then I did make a Facebook page. It's pretty recent, but I share the same content on my Facebook page, and that's just under Dr. Romie Dhaliwal as well. So that's the main two ways you can reach out to me until I start my own practice, and then I'll have my own web page and all that jazz.
So spring 2023, we're anxiously waiting for that to happen. And as I mentioned to all of our viewers, Dr. Romie Dhaliwal is going to be the feature cover story for the launch issue of the Manitoba South Asian Health magazine. We are all across Canada in 6 provinces, and we're super, super excited. When you do your launch, hopefully I can make it out.
I need to meet you in person. Yeah,
we need to align the marketing, because I'm advertising agency. I got to do my plan. I'm all about marketing. So we'll be right there with you, and we'll be helping you promote the brand online, in Manitoba, any which way we can across Canada. And you are going to be one of our resident experts when it comes to eye health. I look forward to having you on our show again in the near future. But Thank you so much for taking time out of your busy schedule, and we will talk soon.
Okay. Well, thank you. It's so awesome to connect with you.
Thank you, everyone, for joining us on this episode of the South Asian Health Show. Stay tuned for our future episodes. Thank you. Bye-bye.